talk that had been scheduled for today, which the topic just went out of my mind, we will make sure that that gets rescheduled into the schedule so that you don't miss that topic. For today, we're going to be focused on shared decision-making. So as a pharmacist, I have this set up as looking, it could be used for a number of different things. I set this up with a case example for the best path toward medication compliance or adherence. So it can be used in conjunction with motivational interviewing, and it's a way to really build an alliance with your patient and your patient's caregivers or family. So our objectives for today are to identify the steps in the shared decision-making process, to describe how shared decision-making can fit into treatment plans, and to outline at least one example of how it could be used. And I did do this from the lens and perspective of a pharmacist, so you will see that it pertains to medication. Those will be some of the examples that I use, but you can use it for other decisions as well. So let's start at the beginning. So what is shared decision-making? It's an approach where clinicians and patients share the best available evidence when faced with the task of making decisions, and where the patients are supported to consider options to achieve informed preferences. So it's really designed to be an interactive process in which both the clients, potentially family members, caregivers, and the treatment team members work together to make a decision. So it's going to involve a number of steps, but it's really trying to encourage them to be an active participant within the decision-making process. So confronting any type of decision that needs to be made, and if you're new to shared decision-making, this may be done in a way that's even looking at smaller decisions. So decisions about maybe where to go for dinner, or something more minor, orders of how maybe kids are going to do things when they come home from school. So you want a snack, you need to get your homework done, and maybe you have some chores that you need to do, and to talk about some of those options. So it can apply to any decision that needs to be made. There are three main steps for shared decision-making: preparation and information gathering, discussion and generating a decision, and then reevaluation and revisions. I think that last piece is really important. It's a way to be able to demonstrate that this is a continuous process, that just because you've made a decision, you can go back and reevaluate, and if we need to make changes, we can do so. But it's just acting on what would be best for the circumstances right now. So the process of shared decision-making, we're going to start with the preparation and information gathering. Good afternoon, Doug.
Hello.
So in the preparation and information gathering, one of the first questions to ask is, how involved does the client wish to be in this process in making the decision? So if it's related to medications, is this an individual who really defers to the healthcare provider and thinks, whatever you think is best, that's what I'll go with? Or is this someone who wants to be a little bit more engaged in the process overall? So do they want to talk through the options and really think about it and evaluate it to weigh in a little bit more heavily? You can see the balance there in the middle. So it does have both the healthcare provider and the client or patient on the level. Participation and preference is a part of it, especially with mental health. Capacity may be a part as well. So if there are individuals who may have developmental disabilities, intellectual disabilities, if they have other mental health conditions or other conditions that may impair their decision making, then they may not have full capacity to make some of those decisions. I think one of the more extreme examples of that may be involuntary hospitalization, where they may be a potential harm to themselves and they may not want to go into the hospital, but their capacity may be hindered by their suicidal ideation. So that does play a role. For patients or families where you believe that that might be an issue, so maybe even in some very difficult family dynamics, if there are other folks, legal guardians or the Department of Jobs and Family Services, Jobs and Family Services for Child Protective Services, if they need to be involved in some of those decisions related to care, certain interventions, therapy, it's helpful to lay that out front, to say, there may be decisions or times where we do need to have some other people involved, but that way it's out front and the patients and their family members and caregivers can still be an active participant. Other things to consider are what values, preferences, or goals does the patient or client have that influence the decision. So if there is something in particular, and I didn't see Laura on here, but patients who may be Amish may have very different considerations than an individual that you may see in the middle of downtown Cleveland. So there may be a number of other factors that may influence the decision. Maybe they prefer to do something, but it's not going to be a treatment that's local that they'd be able to travel to easily. So lots of things go into considering what may influence the decision. Once we've prepared for that, it's about brainstorming all the options that you can think of. So providing examples, even if it's not necessarily something that you would be incredibly supportive of. So if a patient comes in, maybe they have asthma, but they'd really rather not use an inhaled corticosteroid because the parents are concerned about long-term adverse effects. So one of the decisions may be not using an inhaled corticosteroid, or maybe using other medications, and you're really looking at the full breadth of all of the options that are out there. And we're going to talk about the evaluation of each of them in just a couple minutes. But once all those options are out there, it's important to then identify what questions need to be answered regarding the decision. So some of the questions that may need to be answered are, why are inhaled corticosteroids recommended for kids who have uncontrolled asthma? What would be the benefits? How is this going to help them? What does the safety profile look like? What is the time frame that we're looking at? So providing some education and additional materials for the patient and their families. And this is where decision aids can come in. So they could be a supplement that may help provide some information for those patients and family members. So there are a number of resources that are available. This is the shared decision-making worksheet that's included in our first program materials. So the treatment of patients who were just recently diagnosed with schizophrenia. So as you can see, the decision that needs to be made, the goals related to the decision, brainstorming of the options, and then those questions that need to be answered. And this can really help guide some of the discussion. So this can be done with a number of other individuals, and then those questions, especially if there's additional information that's needed, can help guide the discussion when the patient and their family actually meet with the healthcare providers, so that when they have a need, when they have not much time to be able to get information, they can really focus in on what's most important. Thank you. So the second step is discussion and generation of a decision. So reviewing the information, those decision aids that they were given, and talking through to be able to narrow those options down. So what is it that would be most reasonable, most feasible for the patient and their family? There are resources like the Ottawa Decision Guide, which I think I have an example of on the next page, that can really help get to the point where they can make that decision. So this is just another example of a resource, but as you can see in that middle table there, they can put option 1, so not using any medication for asthma. So reasons to choose that: they wouldn't be exposed to other medications. And then how much that matters to the patient and their family. Reasons to avoid it: maybe the child's already had a handful of asthma exacerbations and their activity is being incredibly limited. They're woken up many nights a week during the night because of breathing problems. They've ended up in the hospital. They're getting infections. So we would include all of those and reasons to avoid that option. And then they can star how much that matters to them as well. And they can do that for each of the options. And this really helps lay out those that are more important will go to the top of the list, and they may be the couple that really get talked about a little bit more closely. So do we just do a rescue inhaler, or do we give them a controller inhaler? Can we wait longer? What might that balance look like? So that really helps narrow it down. And it gives them something to do to be able to organize that so they're ready for the discussion. It is important that they then make the decision. And maybe the decision is, we're not comfortable with the inhaled corticosteroids, but there have been 3 ER visits in the last month, and my daughter's unable to breathe. She can't even participate in gym, and we're up most nights now because she is having difficulty. So we're going to try it for a period of time and then see what happens to reevaluate, and that's this last step here. So letting them know that just because they've made that decision doesn't mean they're stuck with it forever. Now you can't ever come off of the inhaled corticosteroid, but it's checking back in. So what are the benefits? I think this is something that's really important, especially in mental health. So what is it that this medicine is supposed to do to make things better? If it's a patient that has schizophrenia, for example, the hallucinations, well, they may not make all of them better. They may not get rid of all of the delusions, but they may make it more manageable where they can carry on a conversation with someone else, or they can talk about other things other than what their delusion may be. So identifying those benefits, the reasons why something was good for the patient, and then looking at the consequences. So what happened as a result of it? There may be adverse effects. Maybe there are other consequences that we didn't think of. Now that my daughter's on an inhaled corticosteroid, you know what? We have a much better regimen, and the whole morning is much smoother. So she's sleeping better. Nobody's as stressed out. We're not forgetting stuff as we're trying to run out the door because it's super crazy. So sometimes seeing the consequences in the big picture can be helpful. And then looking at whether or not a change would be necessary. Should we continue on this path, or do we need to go back and potentially look at a different option? So I included at the end here just an example. So Heather's an individual who's working with a brand new family that's establishing care in your clinic. So the patient is a 17-year-old who was recently admitted to the hospital for suspected bipolar disorder. The patient and his family are considering whether or not they want to continue on the antipsychotic medication that was started because it really makes him incredibly sleepy. He has a difficult time getting up. He's falling asleep in class, so it seems like it's causing some trouble. So in the information gathering standpoint, what would be important? Maybe this individual in the family, it's really important that he finishes school. So that may be a goal, a driving factor. Are they okay with the medications? Do they believe he was hospitalized, that there's something there that actually needs medications? And here is an example of a decision aid. So maybe they're not opposed to medications, they just want one that wouldn't make them quite as sleepy. So we had created for different side effects for the antipsychotics kind of a general reference sheet. So they'd be able to look at it and say, you know what? We were put on risperidone and it makes him super sleepy, but maybe we'd be okay with switching to something like the aripiprazole because maybe it's not as likely to make him sleepy. So it's an approach that could be used. It's really designed to be more empowering for both the patient and their families to get them involved in the decisions. I think it's interesting, some of the research, which I didn't include in here, much of it's been done related to screenings. So shared decision-making related to cancer screenings or other diagnostic tests. So what would be the pros and cons of doing different things? A CAT scan versus an MRI versus another test that an individual may need. In there, the findings have been very positive, both on the healthcare professional side as well as on the patient side. The patients feel better informed. They feel like they have more control, that they're contributing. The healthcare providers feel like they have an educated patient and that there is a clear path of what the treatment's going to look like. When you start looking at mental health, though, some of the results are a little bit disappointing. There are a couple trials that look specifically at children and families children that have ADHD and their families, and using a shared decision approach with their treatment team, the parents and the families, the parents and the patients feel like they are a bigger part of the process, but the healthcare professional results in those trials felt that this process just helped guide the patient to what they wanted them to do anyways, which really isn't necessarily the goal. So it is important that all of the options are talked about, and that information is provided so that they can make a clear decision. So antidepressants help for some individuals, but there is an increased risk of developing suicidal ideation. Maybe a different option would be better. Maybe looking at counseling, CBT, maybe doing meditation, maybe doing an exercise regimen. There are other options, and that really is the goal, to make sure that you're giving a clear picture and not necessarily limiting them down and giving them just enough information that they pick what you want, because that may actually undermine the overall rapport of those relationships. And the goal is to build them up and not make it feel like you're really targeting them down to just what you want to do. So that it would be the only word of caution that I would offer with that. So with that,